Good evening. I hope everybody can see me okay here. Let's see. All right, it shows we're live. So if you have any questions, ask at any time. What I'm going to talk about today is based on so many questions I receive that I just need to clarify. People are always asking, what is the best remedy for this? What can I take for that? In very generic terms. And there is no real this for that in treatment as far as using natural remedies. That's kind of a paradigm that we've adopted in the medical professions. They have a medication, this for that, for everything. And if they don't have a disease for it, they create one. So it all comes back down to what we talked about in the first couple of videos where we're talking about the pillars. You need to find out the root cause. What we're going to talk about here is kind of distinguishing the difference between acute and chronic. An acute manifestation is something that's happened. It's just happened. It's current. An injury, an illness, something that brings on a sudden problem. Chronic is more accumulative factors in your life based on some of the lifestyle habits that you have. And you can have acute manifestations from time to time, but unless you get to the root cause, you're just kind of bounce off of it and not really address the problem. If it does help a little bit, it's going to be temporary. It's not going to have a lasting effect. You need to get to the root cause. A good example of that today, I worked in the yard too hard and it dehydrated me a little bit and I got a headache. And that's a real common manifestation with dehydration. But people will come up to me and say, well, what is the remedy for a headache? Well, why do you have a headache? You always have to question, why do you have this problem? There is no fix for it other than being well hydrated. So there's a lot of different things that cause headaches. And there's not one specific remedy that is the particular one that needs to be given for that. One of the things that I teach and I really encourage people to do is to learn how to use in homeopathy, is to purchase and learn how to use a remedy kit. They have them either in 50 remedy or 100 remedies. And I really love this. And it comes with a little sheet that gives you instructions on what remedy is best for certain acute problems, and when you can look up the problem itself, and it will tell you which remedies to use. In order to do real homeopathy, you have to go through and do a very detailed interview with someone to kind of find out a lot of information about them. And then you use what they call a repertory to kind of go through and look for all those different symptoms and create the one remedy that fits the picture that's their constitution. The problem with that is that worked really well 200 years ago before we had the Industrial Revolution. But we have so many things that block what we manifest in our constitution that we have to unlayer all those things. And that's how we deal with things in a chronic manner. And again, you can do it with homeopathy. It's a much more complicated process. And it does require a professional homeopath to really know how to do that correctly and to have the resources to do that. But for everyday problems that come up, especially if you have children or animals, they will respond really well to just single and multiple remedies that are used for acute problems. If they fall and skin their knee or something of that sort. Now, obviously, if it's life-threatening or if they've broken a bone, you need to go to the emergency and get that dealt with. But as far as healing it and dealing with the pain and suffering, homeopathy really shines. There are a few remedies that are specifics and in acute, and you kind of learn those as you go along. And that's why I said it's really good to get a kit and get really familiar with it. There are certain things that you'll say. Most people are familiar with arnica for any kind of injury or trauma. That's the first go-to that most people get familiar with. Things like apis for allergic reaction. People that tend to have problems with certain food allergies and things like that, it's wise to carry APIS with you. It may not be the complete picture fixing, but it will certainly help the symptoms tremendously and might even stave it off. Then hypericum for a smashed finger, or roost tox for poison ivy. There's just countless things. And those remedies are good for other things too besides those. But those are just the ones that have kind of through the years have been associated with it, because the remedies kind of treat the kind of manifestations that that particular remedy in its crude form would create. And that's a whole talk in itself as far as how homeopathy works. It's a different paradigm for most people, so it's kind of out of the scope of what I'm talking about today. But just know that for acute problems, that's where it really shines. For chronic problems, you need to get some professional help. There are several books out there that can also help you, and I'll show you a few of them here that I like. This is probably my favorite one. It's by Miranda Castro. Well, this is backwards for you probably, but it's called The Complete Homeopathy Handbook by Miranda Castro. That's a really good one. This one is by Asa Hersoff, and it's Homeopathic Remedies. Put up there. And this one by Panos and Heimlich is Homeopathic Medicine at Home. Again, you can go back and watch this video to look at these. And then this is Everybody's Guide to Homeopathic Remedies, or Homeopathic Medicines by Cummings and Ullman. These are all good resources. You don't need to have all of them, but just pick one or two. This is Eileen Newman, and she has just a first aid 911 kind of homeopathy, help in homeopathy. And then there's another little homeopathy for the first aider by Dr. Dorothy Shepard. And lastly, I have Family Homeopathy by Pal Callanan. So those are a few resources that you can purchase. Like I said, Amanda Castro's book is if you can only get one, that would be the one I would probably suggest. Get that and a kit. If you need some help on how to locate what you need to get, feel free to contact me, and I can give you some direction where to find them and how to use them. Again, chronic illness is cumulative. It starts even before we're born. If you kind of just consider yourself a barrel and garbage in, garbage out, as every time that you have any kind of trauma, injury, illness, medicine, vaccine, anything that has chemical orientation to it, especially or traumatic, causes an imprint in the body, and it's a toxin. It can also include electromagnetic toxins, emotional toxins. There's a whole battery of different things that can accumulate in your body. And so you need to stop putting them in, and then you need to drain them out. Homeopathy is the best thing out there for doing the drainage. There's lots of different detox programs out there. And again, going back to the pillars that we talked about, you need to make sure that, first of all, that your organs of elimination are working properly. Make sure your bowel movements are regular and in good shape, that you really are healing your gut with good diet, plenty of hydration, and all the other things that it requires. So the organs of elimination, the kidneys, the liver, the skin, doing a lot of sweating. Some people like to get a sauna, and that's a really good way to detox. But most people in the biomedical world, when they're dealing with chronic illness, will employ most of those different modalities. And sometimes that it'll help a great deal. Of course, it's going to help. But sometimes they kind of hit a plateau and they're not going any further. And that's when homeopathy really helps, because it works at a different level, at a more cellular level. And it will allow the cells to release things that would normally not release them. A lot of people have some genetic predispositions to not being able to excrete, and those things need to be addressed. And again, we do that with homeopathy as well. But this is, again, that's chronic treatment, and you need to get someone that knows what they're doing with that. But just eliminating the causes, stop eating the bad food, stop drinking the bad water, get your exercise, your fresh air and sunshine, and reduce the EMF exposure that we talked about before. All those factors are imperative in order to deal with any kind of chronic problem. Again, some people will go with herbals. I do use a lot of herbal remedies, but you need to have some experience with it, because herbs, unlike homeopathy, homeopathy has no side effects. It has a response, but it doesn't have any toxic side effects because there's not any crude substance in it. With herbs, you do have a substance there. It has a spectrum. It goes all the way from nutritive to poisonous. And depending on what your outlook and what your knowledge and what your intention is, you would have to know that to know which dosage and how much to use. So it requires a little more skill and knowledge to using herbals. Using the nutritive herbs are always good. Things like nettles. I mean, anybody can use that at any time. You could put it in your smoothies. And that's a good nourishing herb. But as far as treating illnesses or detox using herbals, you need to have a little more instruction on how to do that, because you can't overdo it. Okay. Again, you need to go back to the pillars and make sure all those things are being addressed, because like anything else, if you leave one leg of the stool out, you're going to have some lopsidedness and it's going to be imbalanced. So you have to address all those different pillars in order to have good effects. Again, I encourage you to go out there and get as much training as you can. And then, of course, if you have any questions or need any guidance, please contact me. I'll be doing, like I said, these little short YouTube videos. I'm really looking for some questions from people so I know kind of which way to go. The questions associated with being acute or chronic are probably the most common ones that I receive, because everybody is in that paradigm of this for that. And so that's a real important point to get across. But go ahead and you can contact me on my YouTube channel here. Leave a note, or you can go to my Facebook and you can like and friend me there and ask questions. And again, I'm a medical professional, but I don't do diagnosis or treatment or anything on this kind of a medium. I work through a professional service. I also will do counseling on the side independently. But if you have any questions or need further information, don't hesitate to contact me. And if there's nothing else at this time, I'll kind of leave it off here and see what comes up and see what anybody has any questions about. Okay, that'll be it for tonight. I'll talk to you again next Sunday at 7 p.m. Central Time. And we'll see you then. Good night.